Jonathan Goodwin. Very good to meet you. And this is Wednesday?
Yeah.
All right. How are you, Wednesday? What's been going on with the baby?
Well, so she's got pulmonary stentosis.
Okay.
We just adopted her a couple of months ago.
Okay.
And we took her to our local vet to get her checked out. And he basically said, looking at her echo results, that she can see the cardiologist. She had, I guess, two, I'm brain freezing.
It's okay.
The balloon surgery.
She had them already?
Yeah, she had two balloon valvuloplasties as a puppy. And
Do you know where she had those done?
so she's from like a rescue. She was born out in Oklahoma, I guess.
Okay.
I don't have a lot of information about
All right. So 2 balloon valvuloplasties previously.
Yeah.
Okay.
But yeah, she passes out occasionally
Okay.
with exertion or stress. It's okay, honey. It's okay. Yeah, she'll like kind of be fine, and then you can see her like start to lose her lose consciousness, and then she kind of keels over.
Got it.
Pops up after like 15, 20 seconds.
Fair enough.
And then is basically fine.
Got it. All right. All right. Well, we can at least get you some answers and take a look and see.
Yeah, our local vet, Dr. Chin, he thought she was going to need another valvuloplasty.
They did too, and they haven't. Like, we need to. It's not like something you just keep doing over and over and over again. Had she been collapsing the whole time?
Yeah, there was sort of a known thing when we got her. They told us that.
1, 2, and 3. There you go. There you go.
Good girl.
Goes on out to the body, gets returned to the right side of the heart, and is our right atrium, tricuspid valve, right ventricle, and gets pushed out to the lungs. What I'm seeing is the right side of the heart's gotten bigger. It's gotten bigger because it has to work harder to get blood through this tight spot here. That's where the valvuloplasty has been taking place.
Okay.
They're trying to get blood through that little narrow pathway there. We look and see how much pressure the heart's having to generate to get through that tight spot. Normal's like 0, severe is anything over 80, and you look like you're coming pretty close to 200. I'll get an exact measurement on that. But that's why we're collapsing. Is she on any medications right now? Atenolol?
Atenolol. She takes trazodone, like half of the morning. Then
if you were really looking for a procedure to do to help her out, the next one would be pulmonary arterial stenting.
Okay.
The stent would be placed in there to try to see if they can keep that vessel more open. Great job. Love your ears. You have a couple of options. Number one, you can try to keep her where she's at. Like you said, if, you take the little extra little steps here and there to try to make it less likely for the episodes to happen, just knowing they will at times. She'll see a squirrel and she's like, I'm going for it!
Yeah.
And then she may not make it. She might make it. She might grab the squirrel and then pass out right after. But
It's okay. It's okay. Come here. Good girl.
there's that option versus if you're like, oh, I'm so terrified of these episodes, I can't stand to see them. Then the next step might be stenting to see if we can keep that area to stay open. Her pressure, I don't know what her pressure was before, but it's about 202.
It's real bad, right?
Yeah, it's pretty. Usually when they're over 150, I feel like you see the falling over episodes. So she's about 200. So I mean, like I said, you have options if you wanted to take next steps. You're not forced to do that by any means. We can start here, see where she goes, see how she is. We can make little changes to see if we can help her out, but most of this just seems to be that area, that little focal area that's pretty obstructed out there.
And you don't think it's something that's going to progress and end up being a life-threatening?
No.
That's really good to hear.
This disease itself is not life-threatening. It just interferes with.
Talk to cardiologist. I know it's definitely got to be at least another Valvoplasty.
No.
Go get her seen right away.
No, not.
That's good, that's
Yeah, she definitely would be. They wouldn't. We would do a stent in her. You know, that would give us the best chance of holding things open. You know, we don't like to keep doing the same procedure over that doesn't work. You know.
The balloons are still in there?
No, what happens is it's like a tight space, and you get in there with a tight balloon, a small balloon, and then you inflate it to open the space.
Right.
And then you're hoping when you do that, you're opening it enough that it stays open.
Mm-hmm.
But sometimes it's more muscular tissue that kind of gradually comes right back. And so then you might need something stronger, like a stent that you leave in there to hold it open. And that's what I think she would be a baby that would be in need of a stent.